As of January 15th, 2025, we have a blow in terms of COVID protections. OSHA had the opportunity to expand COVID-19 protections in hospital settings, healthcare settings. This would have set standards for occupational exposure to COVID-19s in healthcare settings. However, OSHA is deciding to not make a rule, they're deciding not to decide, and are terminating their COVID-19 rulemaking, where again, this decision is effective as of January 15th, 2025. Where they are kicking the theoretical can down the road because they're saying, well, the COVID health emergency has ended, where they believe that any exposure risk faced by healthcare workers would be better addressed through a generalized infectious disease policy. But again, this is just kicking the can down the road. What they could do instead is have a COVID rule and then fit the infectious disease rule to the COVID rule much more easily than creating new rules from scratch. Which again is a massive decision because it tries to normalize COVID as something that is not that bad. That's just the same as the common cold, and we know it isn't. It has very long-term impacts on a person, whether you think you recovered from the acute infection or not. And again, this could have been something they could have had now, and then added on to with the rest of the infectious diseases later on. And an important point for people that are trying to look to get active somewhere is that this was all started by NNU, National Nurses United, where they worked through the legal process in order to put a pressure on OSHA to try and make permanent COVID-19 standards for healthcare workers. And this was back in 2022. But that court motion was denied. But while the motion was denied, OSHA kept working on these rules. But after 2 years, the agency decided that they would not do this. Instead, they would try to adopt a framework that included multiple infectious diseases. Which is good, but there's no reason why you can't have this now and then add on to it later, because that means we still don't have those protections now. We would have to wait however many more years until this becomes a thing. Which means that in that time, healthcare workers are not going to have the protections that they deserve.